Are you having issues with a bed for your loved one who is homebound and or bedbound with decreased ambulation? I'm Bienstock, and I am a board-certified plastic and reconstructive surgeon. My specialty is wound care, and I'm going to help you and your loved one and your family manage the patient in the home in terms of equipment such as beds and wheelchairs. Today we're going to focus on beds. What do you do in terms of beds? If your loved one has a wound, it becomes very challenging to manage it if you have a regular bed. This is because of the mattress and the large size of the bed. It'll make it very challenging for you and or the caregivers to turn them. So I recommend is a hospital bed. Now, unfortunately, insurance only covers kind of the bland hospital beds that you see that are mainly in rental stores. These are generally covered by insurance and refurbished. They're not bad at all. They have a feature where you can elevate the head in terms of elevating the head when the person is eating or having a tube feed, and or it makes it much easier to turn the patient. The reason why it's safer than a regular bed is it has railings. What's the point of railings? The railings help and prevent your loved one from falling out of bed. If you have a regular bed, which I had one time for one of my patients, they fell out of bed accidentally and broke their hip. So having railings is really important, and it makes it much easier for the caregiver, whether it be you, a family member, or a caregiver based on insurance or a private hire, to turn the patient. It's really difficult to jump over a patient in a large bed and turn them from hip to hip to prevent pressure ulcers or to turn the patient in order to treat their pressure ulcer. In addition, we have to talk about different mattresses. If your loved one doesn't have a wound, they're going to get a regular mattress. If they start developing what's called the stage 1 or stage 2 pressure ulcer, which is either redness on the skin or injury to the skin, they can get a gel mattress, which is protective and does help, but doesn't prevent from turning. Most of the patients that I see are pressure ulcers that are stage 3 or stage 4, which means they're deeper. Those type of patients require what's called a low wear loss mattress. They tend to be softer in the center of the bed, which is where the pressure ulcer is if it's involving the trunk. These help mitigate current pressure ulcers if your loved one has them, and help prevent future ulcers from developing, whether it be on the hips, buttocks, or the sacrum. If you have any questions about mattresses and beds, please feel free to leave questions or comments below, and make sure you subscribe to the channel. In another segment, we'll go over Clinitron beds, which is another type of bed that's a sand bed. I look forward to hearing from you in our next episode.